So the goal of the Urogyn Fellowship is to train a well-rounded fellow such that they are very strong clinically, surgically, and research-oriented by the end of their fellowship. And we do this by a staged approach, starting first with an apprenticeship sort of side-by-side model with graduated autonomy throughout the 3 years here at Duke. By the end of fellowship, we hope that our fellows will have become clinician scientists, such that they are well-rounded in both a breadth of urogynecology in the clinic, have very strong vaginal and laparoscopic and robotic skills, and also be able to conduct a variety of research endeavors, such as those that are in network studies, patient-related studies, or even bench science. So our fellowship is 3 years. The first and third year are very clinically heavy, so fellows spend most of their time in the clinic or in the operating room with a couple of scattered research blocks throughout. The second year of fellowship is more research heavy, and this is the primary time where our fellows work on their thesis. And during clinical time, you're spending time with faculty in the clinics in Durham and in Raleigh. And during the OR, it's the same. We have ORs in Durham and in Raleigh. And the populations in these two areas are a little bit different, such that our higher risk patients are in the Durham area, our lower risk, more private patients are in the Raleigh area. And so some of our clinical time is spent with our GI doctors, with colorectal surgeons, with physical therapists, and also our individual faculty have different specific interests, anything from congenital abnormalities to recurrent, difficult to treat UTIs. And so the fellows will get a variety and breadth of experience in their clinical years. With regards to research, our fellows have 2 major projects that they work on, as well as a couple of other side projects that they might be interested in. So their major project is their thesis project, and we work with the fellow from day one to figure out something that interests and drives them, and we're able to connect them with people across campus to be able to complete that project by their 3rd year. At the end of their 3rd year, they present this project at our Hammond Research Day, which is our big research presentation day for our whole department. For their QI project, they identify something, some need, some process that needs some attention and improvement, and their goal again is to have this ready by 3rd year in order to have a deliverable to improve a process. Developing their research, we help them with statistical support, we help engage them with collaborators on the university side or in the clinical realm, and we also help them develop a breadth of research skills. And so it's important for us, for the fellow, to not only develop the skill that's specific to their thesis, but have skills that they can then grow and develop over time as they become junior faculty. So in the past, fellows have had a variety of projects in research. Some of them have included AI projects, prediction models and calculators, basic science sort of things, tissue regeneration, mesh-related projects, and also retrospective and prospective studies. So you as a fellow would work with a faculty member one-on-one in order to identify a project that is meaningful to you. And so we pair you with a mentor and hope that you will work with that mentor in order to grow the project from a project proposal and a grant submission into a thesis project by the end of your 3rd year. Our fellows spend 3 years with us, and during that time we divide their years into individual milestones and learning goals across the 3 years. So we have 3 fellows, and at any given time there is a clinic fellow, an OR fellow, and a research fellow. So the clinic fellow primarily sees patients in clinic, as well as does a couple of ambulatory surgery operations. The surgery or OR fellow primarily is doing surgery every day. And then the research fellow is working on their thesis, their QI projects. So when fellows are on their clinical blocks, they will be primarily in urogynecology. They also have rotations in GI and colorectal surgery and urology. We work very closely with those specialties to make sure that the fellows are exposed to very high yield topics that are relevant to urogynecology. The thing about Duke Urogynecology is that we are quite a large program in terms of comparison to other urogynecology programs out there. So we have 8 clinical faculty who have a variety of roles both locally, nationally, and internationally. So we have chairs, we have people who have been president of OGS, we have people who are on the board of our Journal of Urogynecology, and every one of them brings a diverse experience from their clinical niche to their research to some of the other projects that they do globally with global health and other things. And so when a fellow comes into our program, they have a number of avenues that they can explore in terms of whatever their interest is, and really the sky is the limit there. Our goal is for our fellows to leave the program with a solid foundation and ability to think and innovate, because what we do today won't be what we do tomorrow. And so our hope is that while you build a foundation, you also have that mindset of how can I make this better? How can I grow this into the future of urogynecology? So our fellows are involved in all aspects of clinical care, from seeing patients in clinic to doing office procedures, as well as assisting and performing surgeries as the primary surgeon. They also are involved in a lot of major projects for our research, leading some projects and also sort of tagging on to others. And our hope is that they learn by doing, and then they learn by teaching and by leading. And so they can grow their skills in their toolbox such that they can become independent academicians after graduation.